Hello, this is Stephanie Sear, and in this presentation, I will be discussing the healthcare systems in the United States and Australia, comparing how the two countries address the healthcare needs of their residents. The objective of this presentation is to analyze the U.S. healthcare system with the Australian system, and will focus on the factors of quality, cost, and access as they relate to each system by using 6 indicators that inform each scheme. This presentation will look at 6 indicators for comparison, including the quality of healthcare, levels of consumer and patient satisfaction, health outcomes, long-term care, the cost of each system, and current threats to the national healthcare systems. According to the Agency for Healthcare Research and Quality, a division of the U.S. Health and Human Services Department, quality in healthcare is defined as, quote, the degree to which healthcare services for individuals and populations increase the likelihood of desired health outcomes and are consistent with current professional knowledge. While the Institute of Medicine lists the following factors of the healthcare system as contributing to quality: effectiveness, efficiency, equity, patient-centeredness, patience, and timeliness. The quality of American healthcare systems is analyzed by evaluative processes and is specific to different areas of medicine, including prevention, inpatient treatment, patient safety and pediatric quality, and consumers designate critical healthcare needs and goals, which include staying healthy, getting better, living with chronic illness, and navigating end-of-life care. The Healthcare Access and Quality Index is scaled from 0, the worst ranking, to 100, the best, and is based on amenable mortality. Among peer countries, the U.S. ranks last with a score of 88.7 in a measure of healthcare quality and access, while Australia ranks second behind the Netherlands with a score of 95.9. The quality of Australia's healthcare system is highly regarded and has a, quote, excellent international reputation, where public and private hospitals provide good quality care and support medical research. Healthcare performance is evaluated using the Australian Health Performance Framework, in which value, sustainability, and priorities are analyzed using a framework and a performance logic model examining inputs, activities, outputs, and outcomes. Patient surveys are used in both the U.S. and Australia to understand how individuals view their healthcare systems. Satisfaction related to healthcare in the U.S. differs among those who receive public insurance as compared to those who receive private insurance. Ray et al. Found that individuals with private health insurance were less satisfied with their care than those who receive Medicare, and compared to those who receive Medicaid, individuals with employer-sponsored health insurance are more likely to have medical debt, more likely to put off appointments due to cost, and more likely to not take prescribed medicine due to costs. The study by Ray and colleagues found that those who have private health insurance are more likely to report poor access to care, higher cost for care, and less satisfaction with care compared to those who receive publicly sponsored insurance, which may be more cost effective. In Australia, most people reported satisfaction with healthcare provided by general practitioners, with 3/4 of patients feeling listened to, respected, and having ample time with their provider. Those with better health reported more satisfaction with care than those with poorer health, and those with high socioeconomic standing reported greater satisfaction than did those of low socioeconomic standing. Those aged 75 and older reported excellent or very good quality care from their GP, in contrast to those in younger age brackets. Life expectancy, along with child and maternal mortality, are important and often used measurements for gauging a population's health. More than 3.6 million babies are born in the U.S. annually, and infant mortality in the U.S. is currently 5.22 deaths per 1,000 live births, while the current maternal mortality rate is 19 per 100,000 live births. Life expectancy was 77 years in the U.S. in 2020, a decline from years prior due to the mortal impact of the COVID-19 pandemic, despite the all-cause mortality rate, a measure of quality, was in decline in the U.S. and comparable countries prior to the pandemic. The vaccination rate for COVID-19 in the United States is currently 76.3%, with children and young adults receiving vaccinations for many ailments according to a schedule from birth to age 18. More than 300,000 babies are born in Australia annually. Australia has one of the lowest infant mortality rates in the world, with 3.2 deaths per 1,000 live births, which is lower than the 2019 rate of 3.3 deaths per 1,000 live births. The current maternal mortality rate in Australia is 6 deaths per 100,000 live births. The 2020 life expectancy average in Australia was 83.3 years. Male life expectancy at birth in Australia is 81.2 years, while female life expectancy at birth is 85.3 years, with both ages representing increases from previous years. The Australian Bureau of Statistics attributes this increase to, quote, improved health services, safer working environments, and medical and technological advances. Australia's Medicare program offers free vaccinations and cancer screenings to select population groups, and the current rate of vaccination for COVID-19 is 85%. Long-term care in the U.S. is defined as services and supports that assist patients with tasks related to everyday living, including bathing and dressing, and may take place in assisted living environments within the community or at home. These services help individuals maintain their current way of life and ensure safety in completing everyday tasks. Long-term care in the U.S. is expensive and is not covered by Medicare. Therefore, personal funds are required to receive these services if an individual does not qualify for Medicaid. Australia's Medicare program offers elderly residents free home and hospice care provided by the Commonwealth Home Support Program in all regions of the country, except for Western Australia. This program assists seniors with housework, physical supports, basic personal care, and nursing, while the Home and Community Care Program in Western Australia provides services to the elderly with federal financial support. Vulnerable populations, including retirees and patients with chronic illnesses, receive significant benefits from Australia's Medicare program. In 2020, healthcare spending in the U.S. grew 9.7% to $4.1 trillion, with spending at $12,530 per capita, and accounted for 19.7% of the gross domestic product, with Medicaid spending increasing 9.7%, private health insurance spending decreasing by 1.2%, and out-of-pocket spending declining 3.7% to $388.6 billion. Federal government spending for healthcare grew 36% in 2020 in response to the COVID-19 pandemic. Hospital expenditures, physician and clinical expenditures, and prescription drug costs all increased in 2020. Australia has a complex healthcare system funded by all levels of governments as well as non-government entities such as individuals, private health insurance providers, and injury compensation insurers. According to the latest figures, Australia spent $185 billion on healthcare goods and services, equating to $7,485 per capita, and accounting for 10% of the gross domestic product. In 2017 and 2018, personal spending on health reflected less than 0.4% of individual wealth, the lowest rate in nearly 20 years. The sustainability of the U.S. healthcare system is in jeopardy. The current healthcare system in the U.S. is described as costly, complicated, dysfunctional, and broken, with current threats to the U.S. healthcare system including high cost with poor quality, financial burdens, healthcare being tied to insurance, healthcare disparities, discouragement of care related to cost, overemphasizing procedures and drugs, lack of innovation, fragmented care, and defensive medicine. Americans spend more out of pocket and have worse health outcomes compared to other high-income countries. The U.S. spends more than twice per capita than does Australia on healthcare, and has the highest rates of chronic disease burden, highest rates of suicide, lowest life expectancy, and the highest rates of obesity among 11 other OECD countries. However, despite the financial input into the system, Americans fare worse in health outcomes than do Australians. Challenges to Australia's healthcare system include an aging population with increasing demand on health services, an increase in rates of chronic disease, costs of medical research and innovations, making the best use of emerging health technologies, and making better use of health data. The major takeaways from the comparison of the U.S. healthcare system with the Australian system include the presence of a government-sponsored universal care system. The country has a patient satisfaction rate of 75% and greater, the presence of disparities and inequitable measures among the Indigenous Australian population and refugees in Australia, a government-funded long-term care program, and the fact that Australians are generally healthier than Americans, despite spending nearly half of what the U.S. spends on healthcare. Thank you very much for your attention. The following slides reflect resources used in the creation of this presentation.